Hi, I'm Dr. Steve Walsh. I'm one of the optometrists here at the center. If we haven't crossed paths yet, I look forward to taking care of you after the procedure is done. I'm going to talk to you a little bit about how to take care of your eyes after your PRK procedure is done. The first thing I'd like to talk about is the medication eye drops that we have you on. We'll typically write you 3 prescriptions: an antibiotic prescription, an anti-inflammatory steroid eye drop prescription, and one that's like topical Advil. The antibiotic prescription that we typically use is tobramycin. The tobramycin drop oftentimes comes with a white cap. This is to prevent infection, and you'll use it 4 times a day for a week after the procedure is done. 4 times a day dosing is typically breakfast, lunch, dinner, and bedtime. The anti-inflammatory, the steroid eye drop that we have, the steroids often come with a pink top. This is a medication that you're going to use for a month after the procedure is done. You'll use it 4 times a day for the first week. You'll drop down to 3 times a day for the next week, and then twice a day for a week, and then once a day for a week. And all of that is written here on the schedule. So again, both drops for a week, 4 times a day, and then you'll drop down with a steroid eye drop for a week to 3 times a day, and then twice a day for a week, and then once a day. And so the little boxes here just to mark off when you put the drops in. A good idea, it doesn't matter which order you put the medications in, but when you put the drop in, either mark the box or always put the same drop in first. That way, if you get distracted, because you have to wait about 5 minutes from one drop to the next, and that way if you get distracted or something happens and you come back, you're not quite sure which medication you've put in, if the box is marked, you know that, or if you always put the same one in first, you know that. So always wait about 5 minutes between each eye drop for the medicine. That way you don't wash the first one out when you put the second one in. There's a third eye drop that we'll write a prescription for you for as well. I don't have a sample of that. It's called diclofenac. It's like topical Advil, and you'll typically use it for discomfort for the first 3 or 4 days after the procedure is done. And again, about 4 times a day with that as well. And same thing, about 5 minutes between drops. So after you put the other medications in, wait 5 minutes and you can put the diclofenac in. The diclofenac is great to put in cold, so put it in the refrigerator. That's soothing in addition to the medication, helping you with any discomfort. If you have questions about the medications, don't hesitate to call, but you can always get online and look at this video to review those again. So those will be the 3 medication drops you use. The antibiotic eye drop, the tobramycin, again, is 4 times a day for a week, and then you'll stop. The steroid eye drop is 4 times a day for the first week, and then 3, and then 2, and then 1. We use 2 different steroid eye drops. The prednisone steroid, which is this one, you'll need to shake it really well. It's a suspension, so when you shake it, don't just shake it a little bit. Give it a real good vigorous shake. It should come out milky white. If it doesn't, you didn't shake it enough. The other steroid eye drop that we use and typically use is called Lotemax. Now that drop comes as a gel. It's not a suspension, so you don't have to shake it. But because it's thick, it tends to stick to the inside of the bottle. So one tip I've learned is with the Lotemax is store it upside down so that the drop stays down in the tip. Because we get a lot of phone calls about week 2.5 or so with people concerned that they've run out of their medicine, and it's just because it's all stuck to the inside of the bottle. So just make sure you store the Lotemax steroid eye drop, if that's the one we give you, upside down. So that's it for the medication eye drops. The other thing, let's talk a little bit about your tier kit Happy Meal. So we have a few things in here. We've got your party hat, because you can't have surgery without a hat. We have a couple drops of preservative-free artificial tears. We have a bottle of gel tears, and we have a bottle of vitamins. So the preservative-free tears, these will be your friends for the next month or so. We want you to aggressively use the artificial tears, and the way you tell a drop is preservative-free is it says preservative-free on the box, but it also comes in these individual dropperettes. Now, with the Blink brand, the little tops will pop back down on, so twist the lid off, put 1 drop or 2 in each eye, that's about all you need, and put the lid back on. And try to use up a tube every 1.5 to 2 hours. After about 2 hours, if there's still some left, throw it away and open up another tube. Another good tip is to put these in the refrigerator. Again, putting them in cold is very soothing. As long as you're using any medicine drops, we want you using a preservative-free tier during the day. So again, you'll probably use these for about a month. These 2 boxes may last you for the first few weeks. You may have to stop by and pick up some more or go get some at the drugstore. But again, the big thing that you're looking for is preservative-free, and it needs to be in the individual dropperettes. Now, after the PRK procedure is done, there is a contact lens that Dr. Thomas will put in your eye. You don't have to do anything with that. You put your medicine in on top of it, you sleep in it, and I'll take it out for you after about 4 or 5 days. Once we take the contact lens out, then we'll have you start the blink gel. The reason we don't have you use this beforehand is it tends to make the contact lens pretty gooey, and you're putting enough drops on that contact already. So we'll hold off on this until that bandage contact lens comes out, but once that comes out, then you'll start using this at bedtime and first thing in the morning when you wake up, and you also put it in the middle of the night if you get up. And just use this till the bottle's gone, which usually is about 3 to 4 weeks. This is a little thicker, so it will blur your vision when you put it in, so don't be alarmed or surprised by that. But this is great for protecting those new surface cells overnight until they heal a little bit further along. And then the last thing that we use to help with dryness and healing is the Hydro Eye Vitamin Supplement. This is by Science Based Health. This vitamin supplement you can't get at the drugstore. They don't sell it at GNC. You can get it from us, or you can get it directly from the manufacturer. But you'll take 4 of these a day. You'll take 2 with breakfast and 2 with dinner. Make sure you take them with food. 4 of them a day will last you for a month. And this has really 2 components that are helpful. Number 1, it has an anti-inflammatory component. And anytime after having a surgical procedure, if we can help control inflammation, that's a great thing. It also helps your body, the glands in your eyes, produce your tears more quickly and recover from the procedure. And dryness is probably the biggest thing that you're going to notice for a while after the procedure is done. So we use the tears to help with the dryness. That's kind of the outside-in approach. And then we use the vitamins to help from the inside out. And that combination will really minimize some of the dryness that you might experience after the procedure is done. So again, preservative-free artificial tears, you'll probably use these for a month after the procedure is done. The gel tears, again, at night and first thing in the morning after the contact lens comes out. And again, you'll probably use this for about a month. It'll take that long for the bottle to go away. And then the vitamin supplements. And again, you'll use 4 of these a day, 2 with breakfast, 2 with dinner. And again, that'll probably last about a month for after the procedure is done. Some things to understand, and we'll go over your post-operative instructions, but you will have some dryness, tearing, light sensitivity is very common. You may feel more comfortable wearing your sunglasses in the house, and definitely we want you wearing sunglasses outside for the first few weeks after the procedure is done. In the house, maybe the first few days. Basically, it's just what you're comfortable with, but some people have varying degrees of light sensitivity. With the PRK procedure, until the surface cell layer heals back in, we expect there to be blurriness to your vision. So most people notice some degree of improvement, but it's not great, it's just better. And then once the surface cells close and begin to smooth, then the vision keeps getting better and better. So our first 5 to 7 days after the procedure, the goal is keep you comfortable and let things heal. And then once they heal and the surface cells close up and begin to smooth, that's where the vision things start to come around. So when you come in for your follow-up visit at about day 6 for us to take your contacts out, don't be surprised if you still have some blurriness to your vision. That's normal, and it starts to get better once those surface cells heal. You may get some bruising on the white part of your eye. That's pretty rare with PRK, but it's possible. Dryness and light sensitivity, and then fluctuations or blurriness to your vision tend to be the biggest things that most patients notice. Now, we don't have a lot of don't things to do after the procedure is done, but we want you to avoid any activities that might cause that bandage contact lens to come out. So we don't want you swimming or hot tubbing. It's okay to shower, but don't stand in the shower stream with your eyes open. You can wash your hair and wash your face, just don't scrub your eyelids. It's oftentimes a good idea to keep a towel draped over the shower door, so once you wash your face and your hair, you can just blot dry. Straight in's okay, that's not going to dislodge that contact lens, but side to side you could push that out of there, so just be very careful with that. Once the contact comes out, you can begin to start pretty normal activities. If you're working out, we do want you to try to avoid getting perspiration or sweat into your eyes for that first week or so. We all have bacteria on our skin, and that can carry down into your eyes, and it increases your risk of infection after the procedure is done. Again, contact sports, really just avoid that contact lens coming out, so you do need to be careful with those for about a week or so. We have some emergency phone numbers. If it's during normal office hours and you have any questions or concerns, please call the 614-269-4150 number. When you get the voice message, press 0. That'll roll you over to our front desk, and we'll be able to take care of you. If something happens and it's not during normal office hours and you feel like if you don't get this question answered, you're going to go blind, I definitely want you to call the emergency number. It's 1-800-252-2434, and the emergency operator will get hold of me, and I will give you a call back. Again, if it's not an emergency, if you have a question about drops or something along those lines that can wait until office hours, I'd appreciate you waiting. But if it's a medical emergency that you need to reach out to somebody right away to have the answer, please feel free to call the emergency line. That's your post-operative instructions in a nutshell. Please don't hesitate to stop one of the staff members if you have additional questions. Otherwise, again, we look forward to having you as a patient and getting your eyes fixed and getting you on the road to better vision. Have a great day.